where NHS is not providing, or I even could argue failing, it's where private practice. Why is Mounjaro so popular? Because the NHS isn't providing it. Why can't the baffling thing is? Sorry, no, I was like, why can't? Because there's a stupid rule that I cannot see my patients privately, and I sort of get it from a competition point of view, but on the flip side, like, you want GP practices.
This comes up all the time.
Yeah,
this comes up all the time, right? So you can see your patients privately, Dave.
Oh, okay. Oh,
right?
Okay.
So you can, as long as you are clear that the service you're offering, they understand they are paying for.
Right. Okay.
So ethically, there's no reason you can't, right? If I want to go and buy something from the shop or something from Amazon, I know where I'm paying for it, right?
Yeah.
If someone gives me it for free, I know it was for free. If I'm coming to you to get an appointment, then I'm coming to you to get an appointment privately. I'm coming to get an appointment in your GP service. I'm coming to your GP service to get that appointment.
Yeah.
So if you had an online booking system which was completely separate, offering appointments at different times and offering services, maybe even the services you can't offer in the NHS,
yeah,
what's the problem?
Yeah, because I think the bit that baffles me, I suppose it's then probably from the back end that as a practice, I've got a group of patients who, I would love to say, like, you're overweight, you're struggling, I get it. Mounjaro for a good chunk of patients, other GLP-1s are available, do work, and they do help, and they do give that kickstart. But I can't, and then I'm sat there as an NHS GP going, I cannot give this to you. You do not fulfil the NHS criteria. You're not diabetic. I think the bit that it's probably the back end stuff. So I think what GPs would actually want is that you've almost got, so like practice as the NHS bit, and then saying like, right, for all the non-NHS services, for example, all your weight loss injections. But then I think what they really want is basically it's done in the same building. You can use the same CQC. You can use the money funds back into the same business, and that's where the difficulty lies. Yeah, and I think
it must be separate. You can or can't. It's not that binary. It is purely a sense that you just have to do it and be quite clear about what you're doing and make it clear that this is a service which people are paying for. That's it. And now, how you make that clear is entirely dependent on you and how you set up this separate business entity. You might be able to do the same that business entity in the same premises, but as long as there's no conflict or no perceived conflict, that's the bit you have to prove, right? Is that if you were offering Dave's appointments in the middle of the day when Dave's also working as an NHS GP, I think you're going to get some questions about that. But if you're actually saying on a Saturday morning, I can see people when your NHS surgery is closed. Yeah. And then I'm paying rent to the company. Coming in and and it's all being done absolutely, and you can see how it works. The figures follow the business plan and everything else, and you're not actually working as Dave, the NHS GP partner. You're working as Dave, the weight loss expert. Then that's absolutely
so I
above
think
board, because you'd be marketing that service as how you would do it, and you don't even have to stick a single flyer up in your surgery to do that.
No,
you can justifiably do it without even saying I'm poaching all my patients for money, because all you do is stick it online. If they find you, great. If they want to pay for your service, great.
I think it's that, because it's sort of as the NHS understandably restricts what it offers for free. Completely, yes, pro that, and I know that from a health economics sort of way that has got to happen. But then what I think is lost is that explanation to public and frustration from the public when the media so pushes certain treatments, and you're in a constant battle trying to counteract that, and then you get the frustration because logically you're going, this would work. Like,
Really good, yeah.
yeah, this would really
Why can't
work.
we do it?
And why, and then certainly, taking with the weight loss injection, all the online pharmacies seem to have, or there is a perception certainly that I've seen, that they've just jumped on it. And you've got, well, I tell my patients to, I can't recommend one, but Google it. And as I jokingly say, like, all of your analytics will now show, do you want a weight loss injection? Okay, so sort of in summary, like, if you're frustrated by this, you can do it. So actually, you physically doing is doable, but it's just that you've got to, as a previous video will show, CQC is probably a must. You've got to get probably something to reduce the conflict of interest. Okay, so sort of like, either a separate building or a day that you're definitely not practicing medicine on.
I think it works well. Like a weekend example, that works, or an evening that the practice is clearly shut. The NHS practice is clearly not open.
So there's a clear divide, and then as long as you need to keep it then not as you can't then feed that money back into, say, your medical practice. It needs to be a separate business, and I think that's where people get that frustration of not knowing how to set that up, which probably leads me then, if you want to do that, probably best to jump on a call with Matthew. He will, matthew@docsupport.co.uk, drop him an email. You can get an hour's worth of his time for a good sort of deep dive chat at whatever level you are at with regards to this, and good luck to you.